Good morning all. I am BALASUBRAMANIAN Kanishkaa from 3rd year first semester. Today we are going to see a patient with critical condition of acute respiratory failure, that is acute respiratory distress syndrome. Acute respiratory distress syndrome is a type of respiratory failure in which the patient suffers in difficulty in breathing, and there is an inflammation of lungs is seen in that. And then when the patient comes with this kind of a disease, first what a doctor should do is ABC assessment. It is to check the airway, breathing and circulation. Airway you can find that by what the person speaks. Now we go through some procedure called as the ABC assessment: airway, breathing and circulation. We can find or check the patient by the way he speaks to the doctor, and we have to check the breathing procedure and also the circulation. When the patient, you may ask the patient to breathe and check which muscles he uses for speaking, and also you have to check the blood pressure of the patient to ensure the circulations. The symptoms of this disease may be similar to pneumonia and chronic heart failure. So we have to perform some laboratory tests to confirm the disease. So we go for like a chest x-ray and some blood samples to ensure the disease. Then treatments can be, the patient is admitted in the ICU with ventilation support like ECMO. Then the treatment is given with antibiotics, bronchodilators and corticosteroids, and we have to change the position of the patient lying, and then have to give proper nutritional support, ECMO support and proper ventilation for the patient. So there are various steps involved in this. So now let's see the patient. Good morning, sir. What is your name?
Ravi.
What is your age, sir?
I'm 30.
What complaints do you have?
I'm having a severe chest pain. I'm unable to breathe.
Oh. Are you having any fever?
Yes, I'm having a heavy fever.
When did this happen?
Around 1 week ago.
Okay. Did you consult any doctor, or are you taking any medications regarding this?
No.
Okay. Is your family members are having anything related to this, or any lung disease?
No one has.
Are you having cough and sputum?
Yes.
What color sputum is seen?
It's greenish.
Are you having any edema and swelling in your body?
No.
Are you having any headache in the past 1 week?
Yes.
How about your vision?
It's a bad.
Okay. Do you have any watery eyes, running nose and vomiting sensation?
No.
Nausea? Okay. Okay, let me check you. Then we'll see. We have to check the patient's pulse, and we have to check for any discoloration in the eyes, and we have to check the blood pressure and also the oxygen levels using the oximeter. Now we'll check for the patient's pulse. Patient's pulse is slightly abnormal. It's dyspnea, I think. Then we have to go for a. We will check the patient's heart now.
Correct point.
Temperature checking. We will use the 100 ounce. Now we will check the patient's eyes discoloration. Patient's eyes is in blue color, which indicates cyanosis.
Impressive.
Patient is having slightly high temperature. Now we'll check for the patient's blood pressure.
ஒரு நிமிஷம்
Patient is having a rapid breathing, so now we have to check the pulse and to state to what is dyspnea or to ensure that. Now let us check the patient's blood pressure.
கனிஷ்கா இழுடி வெளியே.
The patient's blood pressure was very high. So now, before analyzing the reports of our patient, first we have to know the causes of ARDS, and the main causes of it are the aspiration, pneumonia, severe sepsis and severe trauma or inhalation injuries, severe pancreatitis and fat embolism, and the transfusion of blood products also may lead to this ARDS. So now we have asked our patient to take the arterial blood gas test and chest x-ray to confirm that he is having ARDS, but symptoms and signs shows ARDS only, but we have to ensure that it is not pneumonia too, because both have similar symptoms and signs. When you see this table in the slide shown, symptoms and signs are almost similar for ARDS and pneumonia, but it is not CHF because our patient had a chest pain and sputum production both. And now we have, when we the laboratory reports of our patient revealed that he had bilateral infiltrates, and also it was localized, and the ratio of our patient was 188. The ratio is that PaO2 by FiO2, and we'll see in the next slide about it. Now there are 4 conditions for ARDS. It should be acute. So anything it should be acute, that it is within 1 week. Then we have to check the ratio, that is low oxygenation. And how to find is that PaO2 by FiO2. PaO2 is the partial pressure of the oxygen, and the FiO2 is nothing but the oxygen pressure of oxygen concentration in the atmosphere, like we can say the inhaled oxygen, that is 21%. So how to calculate is that if the patient, for example, if the patient is having 100 partial pressure of oxygen divided by the pressure of the oxygen, that is 0.21, so it will give the ratio like somewhere around 500. So our patient was found between 198, so it is from mild to moderate. PEP is nothing but the air left out, the pressure of the air left out in the lungs, which is at constant we take 500. Bilateral opacities are seen in both mild and moderate conditions, but now we'll move on to the chest x-ray of our patient. This is how the first picture is how the healthy lung looks, but when we compare with that of our patient's chest x-ray, we see that the heart size is normal, but we see both the sides, that is the infiltrates are seen, so we confirm that it is ARDS. And how can we cure this? The treatments can be like the patient is advised to sleep or in the prone position, and or if the patient is having a low level of oxygen supply, so we have to ensure there is good supply of oxygen. We can give, if the patient is in severe condition, we can give the ECMO support, or through oxygen tubes you can supply oxygen to the patient, and there is physical exercise are given to increase the oxygen. Then proper nutritional support, IV fluids, bronchodilators are given, corticosteroids are given to ensure the patient recovery is good. That's so. Thank you so much.